Thank you, Liz.
Sure.
The power to schedule a doctor's appointment right from your phone and see them in minutes. This is what One Medical Group brings to its users all across the country with a number of mobile and digital care services underway. Joining us now to give us an inside look at the company's newest ventures and outlook is CEO Tom Lee. Tom, good to have you on the program.
Great.
Thank you so much for joining us. Bob Dole and Hank Smith also joining us. One Medical adds digital dermatology service to its app. Tell us about your app and how it's changed over the year.
Yeah, correct. I mean, we are redesigning healthcare from a primary care experience. Dermatology is a common use case for primary care, and we wanted to extend the mobile application to allow you to do digital dermatology through the phone. So you can take an image of a rash and send it to one of our team members, and they'll diagnose it over the phone.
Where are the doctors that are looking at this?
They're part of our care team. So we have a very dedicated office team that takes care of patients in the office, and then we also have a dedicated virtual care team that takes care of people outside of the office. So whether you have a minor cold, flu, allergies, or urinary tract infection, they can take care of it. And now we've extended dermatology to that platform, so you can interact with a virtual care provider via the mobile device.
What's the rate of adoption of these sorts of things? In other words, if I'm a doctor and I've done things for years a certain way, how do you convince me to change, even though if I was coming into the practice, your way is much more efficient?
Yeah. So there's two aspects to this, right? It's a two-sided market. So on the physician side, it's a very difficult thing to change. That's why we built the One Medical platform. It provides a new ecosystem where physicians can practice the way medicine was really intended, really thoughtfully patient-centered, channel independent, really doesn't require an office visit if it doesn't need to. And so we've built that ecosystem that allows the physician to take care of patients virtually, and that's not easy to do. Separate from that, patients aren't used to using that experience, right? They think about going to the doctor normally, so there's a utilization issue. So there's a lot of telehealth solutions out there today, but they don't really kind of think about going to their phone first. That will become the future, but today it's a little bit early still.
How much cheaper is it to do these things with your phone, and are the doctors being paid?
Well, the cost is similar in the sense that the labor cost, the time of a physician to actually review the case is very similar, right? The difference is the payment mechanisms and the artificial nature of seeing these dermatology cases in the office with a dermatologist or a primary care physician is charged to the system, the insurance system, at a much higher rate. And so we're able to do this much more affordably, and within the One Medical construct, it's actually free for members. So you can actually do it very affordably. You just have to have the right economic model to support it.
Hank?
If this takes off from a consumer standpoint, can you attract enough doctors on your platform to meet that potential demand?
Yeah, we already have enough providers on our platform to meet the demand today. We just launched that service, but as our membership continues to grow, we're able to kind of really staff that. You'd be surprised at how many cases a physician can review virtually, and so our virtual care team can handle a pretty significant load. And so really it's an issue of the market adapting to these changes over time.
And can a member keep his own primary doctor or his own dermatologist and also use your service?
Correct. I mean, we're somewhat agnostic. We're a supplement to whatever primary care or specialty system that a patient might have. We tend to think we have the highest kind of primary care quality system, and it's very accessible, so it's cohesive if you see one of our physicians, but it's not necessary for you to see us for all your care. We refer out to the region's best specialists wherever we are in all of our markets.
I feel like there's this revolution going on in terms of consumerism in healthcare.
Yep.
People are taking on all of these things now themselves.
Yeah, there's kind of a real disruption in the market in the sense that the rest of the industries have really surpassed healthcare in terms of its consumer orientation. So I think people are increasingly looking for consumer-oriented solutions in healthcare. The challenge is, again, the supply. The payment mechanisms don't really support these models. They're mostly funded through enterprise and commercial entities, and so it isn't really oriented towards the consumer. We're starting to see some changes through the Affordable Care Act and progressive employers. We work with progressive employers to re-architect that payment mechanisms. So we work with companies like Twitter and Uber on the technology side, Levi's and J.Crew on the retail side, and a whole variety of employers to progressively adjust the payment mechanisms so that allow us to do much more consumer-oriented healthcare.
Really great stuff. Did you want to ask a final question?
Application beyond dermatology, what might that look like?
Right, that's
yeah,
true.
so really, the first wave is first order stuff. So visually oriented diagnosis is, it's as good as a human eye. In fact, the cameras are now higher resolution than the human eye, so you can actually do a better job virtually. Over time, we already do lots of diagnosis on the phone. And so if you really look at strong healthcare, it is through history. A really good physician knows that the diagnosis is primarily through history. And if you supplement it with vital signs and kind of some simple diagnostics, you can handle 50, 60, 70% of the cases devices that are coming into doctors' offices that may not need to come into the doctor's office.
Very quickly, you can't talk about this subject without talking about safety and securing that data.
Yep.
Where does the data go of customers?
Yeah, so we're a tech firm based in Silicon Valley. We look at all the best of class standards in security and privacy, and we continue to kind of invest in that space. As you know, no institution is immune from that, but we're doing our best to stay ahead of it as best as possible.
Tom, we'll see you soon. Good to have you on the show today. Thanks so much. Tom Lee is One Medical Group founder and CEO. Bob and Hank, more with you coming up. Stay